Since the start of the pandemic, about 40% of adults across the U.S. have reported struggling with their mental health. And with the Delta variant causing an increase in cases, that's not going away anytime soon. Here to talk more about COVID burnout and mental health challenges is clinical psychologist and host of the new podcast, Struggle Well, Live Well, Worry Less, Dr. Kevin Gilliland. Doctor, thank you for being with us today.
Yeah, good to be here with you guys. You
know, that 40% is a big number, but it's not really surprising if we look around us. What do we as individuals need to be looking out for in ourselves and be alert of as far as dealing with possible mental health crisis?
Yeah, you know, the first thing we're hearing people get disrupted with is sleep, which is not unusual. And the next is sort of an anxiety and worry that they can't seem to turn off. And then your energy level being down or a significant change from what it used to be, which sounds like I just described all of us the past year and a half. But when those really get out of line, it usually means that our psychological health may be struggling.
And Dr. Gilliland, you've spoken about maintaining a balance even in the middle of this pandemic and as the pandemic ends. How do we do that? That is a battle when you're trying to juggle work, life, all these things, and to do that inventory and figure it out.
It is, but we do that all the time with our healthcare. We're always balancing things. And if we overly focus on this thing, we'll neglect being physically active. We'll neglect connecting with people when it's safe and when we can. And those things are critical for long-term health. And that's what's, I think, been surprising for all of us, is that this is such a long-term change that when the virus does kick back up, it's almost like we are surprised by it. And that's the healthcare fault and politicians' fault. We have not done a good job of communicating about this. Viruses do this, so we shouldn't be surprised by it. We just have to respond in a thoughtful way.
And you mentioned it, it can come back. It is coming back. We are seeing a surge in different parts of the country, worse than others. How do you manage your anxiety in that situation as an individual? Or for some people who are vaccinated or who have loved ones they've lost or have been sick because of COVID, how do they manage perhaps their anger in this situation?
Yeah, and it's fair. First of all, vaccines don't mean we won't get something.
Right.
And the COVID shot is more like a flu shot. So, and we know people that have had shots can still get COVID. The majority is milder. Occasionally will require some hospitalization. So it's still a very strong thing to do to decrease the likelihood depending on your risk. And then as you look at that, then you also have to look at, okay, I'm in San Diego. Outdoors, the risk is less than 1%. Mm-hmm. It's extremely difficult to contract COVID outdoors. And if you're in a place where you can get outdoors to meet people and to move, your risk, if you're higher at risk, dramatically reduces. So you're doing those things that are good for your psychological health, your physical health, and other conditions, as well as COVID. It's possible to do all of that.
Great advice, especially for people who can get outside. Less than 30 seconds left. Doctor, I want to ask you, a lot of us are experiencing a form of whiplash, going back out into society, maybe having to go back into work. There's a lot of stress involved with that. What do you say to people? And again, I'm sorry, we're almost out of time.
Yeah, manage your information. Get it from good sources like you guys. Use social media to be entertained and laugh. Reduce that amount, get solid medical advice, and look at your own risk and your own area and make good healthcare decisions. You do it all the time. Just keep doing it with this.
Dr. Kevin Gilliland, Struggle Well, Live Well, Worry Less is the podcast. I am going to download it after we're done with this interview and listen to it on a run tomorrow. I thank you for your time and the great advice.
Thank you, guys. Take care.